Welcome to the QPR for suicide prevention. I want to first welcome everyone, and I want to state that hope begins with you. Every 17 minutes, at least 6 Americans lose a loved one to suicide. Most did not have a chance to learn the warning signs, and 66% of those individuals who died by suicide showed the warning signs to family and friends. You have an opportunity to make a difference, and with you logging on to this webinar today, you also have a chance to learn how to help save a life. Thank you for joining us on our QPR for suicide prevention today. My name is Tracy Mazarana, and I have been working at North Central Behavioral Health Systems in total around 13 years. I first worked on the Passages unit, which is an inpatient psychiatric unit, for many years. And most recently, I've been enjoying the opportunity to work here at North Central Behavioral Health Systems in our prevention department, where upon request we do provide schools with educational programs on various prevention programs such as drug and alcohol prevention, and we also provide technical assistance to multiple anti-drug coalitions and communities that we work with. Thank you again for joining and listening in today. I'd like you to know a little bit about myself before I start. I am a mother of 2 beautiful daughters, a wife of a very supportive husband, and I am a daughter that is fortunate enough to have a very close relationship with both of my parents. In addition to that, I am many other things. I'm also a sister. That still depends very much so on my siblings for a lot of support, and even though I am the youngest of 4, believe it or not, they do at times lean on me for support. I am an aunt, a godmother, a friend, a neighbor, and a coworker. My point with sharing all that with you is that it's important to know that we all touch so many people's lives in every day. The topic that we're going to be discussing is suicide prevention. And the fact is that most suicidal people at some point do experience some depression. And, well, depression is an entirely another topic that we can discuss at another time. But one thing to realize about depression is it's similar to the common cold of modern life. Any one of us is susceptible to it at different times in our lives. Suicidal thoughts are actually quite common. Now, suicidal acts, threats, or attempts, on the other hand, they're less common, but they do occur much more frequently than people realize. Suicide is the most common psychiatric emergency, which, as I mentioned in the beginning, I did work on an inpatient psychiatric unit. So I've had a lot of first-hand experience working with folks that are in crisis. Suicide is the 11th leading cause of death in America. Suicidal thinking, feeling, and behavior are not rare. For example, if you are a middle-aged or older adult, chances are you probably know someone who has made a suicide attempt. It's possible you know someone who has completed a suicide. And it is very likely that you know someone who has or is currently thinking about suicide. So who's responsible? Who should be the gatekeeper, if you will? And just to kind of speak on what a gatekeeper is anyone that's in a position to recognize a crisis and warning signs that someone might be contemplating suicide. So this could be you. And you might be thinking to yourself, or you may have thought before, that it would take a professional to recognize or to handle these kinds of situations. Well, it's impossible for family doctors or counselors or mental health professionals teachers, whoever it may be, it's impossible for any one group of professionals to recognize the need for help in everyone. So the answer to the question, who needs to know QPR? Question, persuade, refer, is QPR. Who needs to know QPR? Everyone. Everyone needs to know QPR. It's all of our responsibilities to recognize this in those that are around us. I have a few things that I wanted to discuss real quick before I get started in the actual webinar. Throughout this presentation, I want to encourage you to interact with me by typing in questions and comments using the questions pane. I will be answering questions live after the presentation. So if any of you ask a question during the presentation, it will be answered once the presentation is completed. Also, if you ask a question which is not answered at the end of this presentation, please know I will email a response to you within 24 hours. I would also like to remind all of you that we are recording today's webinar, and we will make the link to the recording available 48 hours after the presentation. So if you do happen to miss something, you will have an opportunity to go back in and listen and see the presentation. In addition to that, I do have printed materials available that I would be more than happy to mail to you upon request. If this is something that's interesting to you, simply request so by using that questions pane. Be sure to include your mailing address, as I will mail this to you via the post office. You'll probably receive it within about 2 weeks after the presentation. So as I stated, QPR stands for question, persuade, and refer. I mentioned to you gatekeepers and what those were. Just to kind of give you an example, potential gatekeepers could include physicians, police officers, school teachers, case managers, and many others. But who else should be trained? And that is my point, I guess. In life, we have different supporters. We have family, we have friends, and we have coworkers and neighbors, and we have clergymen. We have different people that we tap into at different times in our life based on what our needs are. Sometimes we really need some advice. Sometimes advice is the absolute last thing that we're looking for. Sometimes we really just want someone to listen. And so it's real important to recognize in yourself who your support people are. Each of us have formal support, and each of us have informal support networks. I'll try to speak on each here and give you some examples and give you some idea. I myself try to have at least 5 different supporters, and there's a lot of reasons for that. One is you have to ask yourself if you had one person that you knew you could depend on, and you would tap into that person each time that you had needs. Eventually, you must realize what would happen is that person is going to, as much as they want to support you and they want to be there for you, it's going to get really hard on them too. So it's going to put a feeling of a burden on that one individual. And in addition to that, you need to know who others are that you can tap into. Because like I said, sometimes you're looking for advice, and sometimes you're looking for someone to just listen. So keeping in mind that each of us have both a formal and informal support networks. Our formal support network could include those professionals that I mentioned earlier. There's some that we interact around issues of maybe health and well-being. Could be physical or emotional or spiritual support. These gatekeepers would include those physicians and your pastor or therapist or a mentor or personal trainer even. Some of these support professionals assist us with health and health monitoring, while others may help us with emotional and psychological or spiritual needs. For example, a busy working executive's formal support might be his or her physician or their business mentor or personal trainer, whereas a soldier, their formal support might include his or her supervisor or a chaplain or possibly a unit medical professional. Then to speak on the informal support networks consist of those persons closest to us, family members, adolescents, or adult children, close lifelong friends. These inner circle relationships, they may change over our lifespan, but they constitute our most important and stable source of social support. These intimate others may also be the ones who are most likely to recognize our distress and take positive action. One of the slogans of the QPR Institute is the person most likely to prevent your suicide is someone you already know. And if you think about that, it really does make the most sense, because a little later we're going to talk about different signs that you may recognize in someone who is feeling suicidal, and then at what points to administer the steps of QPR. When we go out and we teach QPR, the idea behind it is, even if I'm able to teach this to one person, then what it can do is it can generate conversations about suicide. There's such a stigma out there that people at times are unwilling to even talk about it, that they had feelings in the past of suicide, or that they're, or God forbid that they would talk that they are having feelings of it now. So the idea behind teaching QPR is also to hopefully generate conversations about suicide and to bring some of that stigma down, to talk about its prevention within that person's inner circle, and hopefully increase some odds that should someone among those touched by anywhere within your inner circle, if someone were to become suicidal, someone else close to them would know what to do. So there are some things even here at this moment that you may want to ask yourself. Whom can you really count on to listen to you when you need to talk? Who can you count on to counsel you when you are very upset? These are steps that are important to kind of have the answers to now, so that you're prepared in the event that you would need something. Whom can you really count on to help you out in a crisis situation, even though you realize that that person would have to go out of their way to do so? Now, I realize this list of names would help you to be able to, identify your inner circle. But I do realize that this list of names is usually, it's kind of short. It's not real long. But you do need to note to yourself that someone who cannot generate a single name may be completely dangerously isolated. And that could be a huge red flag for that person. Let's see if I can get an example here. Some may identify their inner circle as their immediate family members, while others identify family and friends. For some, the top names might be husband or wife, adult son or adult daughter. Something you need to think about, again, back to the idea of depression, and how it factors in to suicidal thoughts. For someone to be able to imagine the pain of depression and how it could lead to suicidal thoughts, I suppose if you could imagine the worst physical pain you've ever had, it could be a broken bone, an extreme toothache, or labor pain. Multiply it tenfold and take away the cause. Then you can possibly begin to approximate the pain of depression. The level of pain described is overwhelming for most adults, let alone a child or an adolescent. The fact that the young adult years are emotionally very turbulent anyway, then go ahead and add depression to the equation, and you have a high-risk situation in the making. What I'd like to do in the next step here is I'd like to review some of the reasons that one may determine that it's time to apply QPR, which again is question, persuade, and refer. And I'll go through all those steps with you as well. There's different clues and warning signs. Before you can apply QPR, you must first recognize the warning signs of a potential suicide crisis. Clues and warning signs come in several forms, as I can imagine you would realize. But once understood, they are not difficult to recognize in someone. One clue or warning sign may not mean a great deal, but any warning sign suggesting acute distress, despair, or hopelessness about the future, or a desire to end it all, is definitely worth asking about. QPR, I do want to make sure I mention, is not intended to be a form of counseling or treatment. QPR is intended to offer hope through positive action. You do take on a bit of responsibility when you do ask the question, are you thinking of suicide? Have you ever thought of hurting yourself? It's a really hard thing to say. I don't know if any of you have ever had to ask that question before. When I've done this presentation in the past, we actually take a section of time, we do a role play, and it's highly recommended that you, during that role play time, you practice asking the question. It's a very difficult thing to say out loud, even in a role play situation. There's a lot of different statements that I'm going to share with you. Some will be direct verbal clues that someone may give you that they are feeling suicidal, and some will be indirect verbal cues. While I'm discussing that, you'll see I put up some suicide myths and facts. Some verbal cues. Direct verbal cues. I've decided to kill myself. That's pretty direct. I wish I were dead. I'm going to end it all. If such and such doesn't happen for me by a certain time in life, I'll kill myself. And those are very direct clues. Looking at the screen now, if you would, I'd like you to take a look at some of the myths and facts that I have up there. The first myth stated is, no one can stop a suicide, it is inevitable. That is a myth. Many times people think that. They think once it is in someone's head that there's nothing you can do to change their mind. It's very far from the truth. Many times what someone is looking for, it goes back to my opening statement about hope. Many times what someone is looking for is hope. They want to hear from someone that there is just a glimmer of hope. It's very stressful for someone that is thinking about suicide. They may have been planning for a very long time, and they may be dropping clues here and there, and really all they're looking for is just a glimmer of hope, someone to ask them the question. And once the question is asked, many times they feel a huge sign of relief, like a great weight has been lifted off their shoulders. The third statement on there is another myth. Confronting a person about suicide will only make them angry and increase the risk of suicide. It's another large myth out there. Many people believe that if you ask the question, it'll put the idea in someone's head. And as I stated, it's quite the contrary to that. By asking the question, you're actually offering some hope for that person. So you may ask yourself, how can I help? Well, the best way to help is to ask the question. We'll continue on with more suicide clues and warning signs. It's important to take all signs seriously, whether they're those direct verbal clues that we just discussed or some of these indirect ones that I'm going to discuss now. An example of an indirect one would be maybe some statements like, "I'm tired of life. What's the point of going on? My family would be better off without me. I'm not the woman that I used to be. Soon, I won't be around. You shouldn't have to take care of me any longer." Those are some statements that are a little less direct. They would be considered indirect verbal clues. Now, these are all outward statements, but we realize that someone's behavior can definitely play into this as well. So, behavioral clues. Possibly maybe someone would start giving their money away or some of their prized possessions. Someone may start giving away, some of their jewelry, even cars, and things like that. Any kind of suspicious behavior. Maybe going out at odd times of the day. Maybe waving or kissing or hugging someone goodbye. If that's not a characteristic for someone, then, it deserves some attention, some looking into. Even loss of physical skills or general confusion, just, loss of understanding. If you notice a difference in someone's judgment, too. Increased use of drug or alcohol, or even just a relapse after a period of recovery. Those are also behavioral clues. Someone may have had a long period of sobriety and then all of a sudden they have a relapse. Unexplained anger, aggression, or irritability. Those are some more behavioral clues. And then there's situational clues as well. Being fired or being expelled from school, loss of any major relationship, diagnosis of a serious or terminal illness. And this one can not only affect the person who received that diagnosis, but also you really have to kind of watch those around that individual who maybe received the diagnosis of a serious or terminal illness. Can also trigger things in their loved ones as well. And with all of the action going on with the diagnosis for that individual, it could go unnoticed a little bit. As far as situational clues go, any anticipated loss of financial security or fear of punishments. And now we'll get into some tips for asking the suicide question. As I stated, it's not easy to do. The right setting helps a lot, though, if it's possible. It's good to talk to the person alone in somewhat of a private setting, if possible. You need to allow some time, too. It says here, give yourself plenty of time, and that's true. If this person has been holding this in for, a good amount of time and thinking about it, and if you finally ask the question and they say yes, that they have been thinking about suicide or harming themselves, chances are they're going to want to talk. So you want to make sure that you definitely don't rush the person in any way. Be prepared, if possible. If you've had your suspicions, then have your resources handy, have some phone numbers, local resources. Have some kind of a plan in mind for that. If the person's reluctant, be persistent. Hang in there. Ask it in different ways, and we'll practice. There's some ways to ask. So we'll go over some of those. the important thing to remember, and it's stated here in bold, it's, how you ask the question is so much less important than the fact that you just ask it. You need to get the question out there. Okay. There's different approaches to asking the question. You could try a less direct approach and see if you have any luck with that. Have you been unhappy lately? Have you been so very unhappy lately that you've been thinking about ending your life? Do you ever wish you could go to sleep and never wake up? Just kind of getting that going might get them to start talking about it. I mean, it's important to realize that it's hard to say the S question, if you will. It's really hard to say the word, and if it's hard for you asking someone the question, think about how hard it is for the person that you're asking it to comprehend that they would actually consider that. A QPR intervention, it could take up to an hour. So, like I said, give yourself plenty of time. Listening skills, we're going to discuss those in a moment. Very, very huge important part of this. Let's see what we have next. We have a more direct approach. When people are as upset as you seem to be, they sometimes wish they were dead. I'm wondering if you are feeling that way too. You might say to them, you appear to be pretty upset. I was just wondering, have you been thinking about suicide? Have you ever thought about taking your own life? Or plainly, are you thinking about killing yourself? And it's important to know, if you cannot ask the question, it's real important to find someone who will, or someone who can. I know that you would if you could. It's not easy to say. Here's an example of how not to ask the question. There's a right and a wrong way to say everything. And I realize that I just stated it's not as important how you ask it, but that you ask it. This way you don't want to say it though. You're not suicidal, are you? You don't really want to say it that way. What that throws out there is judgment right away. It's kind of like looking at someone and saying, you're not really going to wear that, are you? I realize that's a lot less serious. But when you say it like that, you're really making the person question themselves. And as hard as it is for you to maybe understand, they've been thinking this is a pretty good idea for them for quite a while possibly. And by you simply stating, you're not suicidal, are you? That throws a whole nother thing into the mix for them. And that makes them feel like they're being judged by you. It can really take away some of the potential for trust. Here's some more examples of ways not to ask the question. You're just kidding about killing yourself, right? Not really the best way to state it. It just, it kind of piggybacks to what I was trying to say before. You don't want to encourage a negative response from the person you're talking with. You definitely don't want to use any type of sarcasm. On the other hand, it can be okay as long as it's tasteful. You can use a little bit of humor to just try to break the tension with them a little bit. And, it depends on how your relationship is with the person. If this is someone, family friend or a friend that you've known for a very long time, or one of your family members that you have a good rapport with already, you might be able to get them to sit down and relate with you a little bit better. But you definitely don't want to imply that you're frightened by the intensity of their feelings, even though you very much so probably are. You really have to be aware of your own nonverbal cues. What kind of signals are you giving off? This is real important, because you don't want to scare them into not feeling comfortable enough to talk to you. It's real good to reassure them that you're someone that they can trust and they can talk to you. The next step in QPR is P, and that stands for Persuade. Okay. Persuading someone not to end his or her life and to get help begins with the simple act of listening. Listening alone can be life-saving. Listen first. This is important. Listen first, then persuade. Listening is the greatest gift one human can give to another. Advice, as I mentioned before, it tends to be easy to give. It's quick, it's cheap, and in this particular situation, many times it's wrong. Listening takes time, a lot of patience, and courage, because this is a really scary topic for you. But listening is always right. Ask yourself again, who do you go to for advice? Your answer is seldom someone who lectures you or makes quick judgments about what you should do. Rather, it is a good listener that we turn to in times of trouble. When someone is feeling suicidal and needs to be persuaded to get help, the gift of listening becomes priceless. To become a better listener, consider that listening means giving your full attention, not interrupting, and only speaking when the other person has finished. Not rushing to judgment or to condemn them in any way. You have to tame your own fear down too, so that you can focus on the other person. Good eye contact is real good listening. After asking the S question and getting suicide out in the open, it's a good idea at that point to listen for the problems death by suicide would solve. You have to confirm your guesses and your suspicions with any questions that you might think of. And if you get nods or yeses from that individual, you have in no small part helped that person find a way to live. The goal of persuasion is simple. All we want to accomplish here at this part of persuasion is for the person to say yes and that they will get some help. A yes to any of the following questions confirms that you have been successful. Here's one example. And again, these examples really depend on what your relationship is with that person and what your role is in their life. Okay, so you have to apply the one that's going to be appropriate for that situation and that individual. Will you go with me to see a counselor? Will you go with me to see the school nurse? It depends on what kind of professional person they are willing to see. Will you go with me to the emergency room so we can talk to someone? Will you let me make an appointment with, could be the local mental health center. It could be an appointment with the school social worker. Whatever it takes to get that step and get that started. Another good opening line with someone would be, will you promise me that you will follow through with, and then have some ideas in mind, such as going to talk to the school counselor. And then it's real important that you stay with that person until help has been initiated. Or, again, it depends on the situation. It may depend on, it may depend on the fact that you need to link them with someone, whether it be a family member or someone at a school, or bringing them to the hospital, or calling for even potentially for police intervention at that point if the situation were to escalate. Sometimes suicidal people will agree to get help, but then they might not get it. They will resist the idea of getting help, even though they seem to recognize that they need it. The more hopeless and helpless they feel, the more difficult it may be for them to make a commitment to get help. It's often a good idea to get the person to agree on living and to make a recommitment to life. And by that I mean just simply say to them, I want you to live. Won't you please promise me that you will stay alive until we can get you some help? A promise not to hurt or kill oneself and to go on living until help is gotten is most frequently met with relief and an agreement to stay alive. Again, many times this individual is looking for some glimmer of hope. When someone makes an effort to make a public promise to stay alive, it kind of appeals to our honor, and then they're agreeing to stay safe provides relief to the suffering person. The answer to this request is almost always yes. When the answer is no, don't worry, there's still something else that you can do. Ask yourself a simple question. If you were angry or depressed or terribly upset and just completely not thinking clearly, would you want those who love you to stand by while you killed yourself? The answer is no. Just as you would not allow a friend or a loved one to die if they were drowning or having a heart attack, neither would you stand by and do nothing for someone prepared to end their life by suicide. What do you do if the person refuses to get help? It's a really good question. It does happen. If the person refuses to get help, it doesn't mean that QPR has failed. In fact, it's just the opposite is true. There are laws in place. It just may be that involuntary treatment at this point may be necessary. In a word, no one has the right to complete suicide without first being given an opportunity to get help. So QPR, by utilizing your QPR skills, you have, with this individual, have recognized that they are having issues, and then they are stating that they refuse to get help. And just at that point, that is where you would have to involve, professionals to get them to the hospital, to have them evaluated, and then the steps would be taken from there. Persuasion does work best when you do the following. You need to be persistent in your statements that suicide is not a good solution and suggest that better alternatives can be found. It's a good idea to focus on solutions to the problems, not the suicide solution. Accept the reality of the person's pain, but you also need to offer some alternatives. And again, I can't stress enough, offer any form of hope in any way, shape, or form that you can. It's also a good idea to reduce the risk by making suicide difficult. Just keeping things out of their reach a little bit is a good idea when someone is suicidal. Suicidal persons are impulsive. They're in acute psychological pain. And they don't understand at that moment, when they're in that moment, that psychological pain, it will pass. But to reduce the risk of self-injury by this impulsiveness that they could be feeling, it's always a good idea to remove firearms, car keys, medications, or other means by which a person may injure or kill themselves. through restricting access to these means of suicide, you may buy the time needed for that pain to pass, for a solution to be found, and for hope to be rekindled. Your willingness, remember, your willingness to listen and to help can rekindle hope and make all the difference. So listening in the Persuade phase of QPR is really important. Now we're on to the R of QPR, which is refer. Suicidal people, you need to remember that they often feel they cannot be helped. So you may have to do more. You may have to have a list of resources ready. You may have to do a little bit of homework before. You may have to make some phone calls to your local mental health center and ask some questions on how you can best help. The best referral involves taking that person directly to someone who can help. Again, it depends on your relationship with this individual. The next best referral is getting a commitment from them to accept help, then making the arrangements to get that help. It's a little overwhelming for them. They may agree to go for the help, but quite frankly, it just might be too much for them to look in the yellow pages and see what's out there for help. The third best referral is to give referral information and to try to get a good faith commitment not to complete or attempt suicide. Doesn't hurt to have them write it in a contract form, to write it down for you. It's important not to hesitate. Remember, since almost all efforts to persuade someone to live instead of attempt suicide will be met with agreement and relief, don't hesitate to get involved or to take the lead. It's important to ask the question. It's important to instill that hope and to let them know that their level of importance in life. Say things like, I want you to live, or I am on your side. We'll get through this. It's also a very good idea to get others involved. This can get a little tricky because you don't want to have them lose trust in you. So you need to keep them involved in all the steps that you have planned. You need to talk to them. Ask them who else might be able to help. Again, these steps that are listed on the screen now, they depend a lot on what your relationship is with the individual. But you could offer to join a team. You could offer to work with their therapy team or whoever is going to provide the counseling or treatment to be there for them for support. A follow-up, you could follow up with them by visiting them or sending them a card, which depends on what you feel comfortable with. Just a way to let them know that you do care about what happens to them, though. When you apply QPR, you plant the seeds of hope. Hope helps prevent suicide. It's an important thing to remember. And like I said in the beginning, humor can be a nice touch. So I did try to put in just some type of a cartoon here, and you can see it reads, Glimmers of Hope, 3 for 50 cents. I sure don't mean this in a sarcastic way. I don't mean to make light of it. It's just, sometimes it really feels that way. It feels like you have to find your glimmers of hope. You can see here I do have a suicide prevention lifeline and a 1-800 number that's listed. In addition to that, we also have our health directions department here at North Central Behavioral Health Systems, and all the contact information is listed as well. I'd like to thank you for joining our webinar today, and feel free to come back in and take a look if you're not seeing, or if you didn't get all the information the first time through. We'll have it posted. I'm going to take a look at this time and see what questions we have. One moment, please. Okay. Let's see. One of our questions is, what about depression? Doesn't that cause suicide? Um, while untreated, depression is the #1 cause of suicide. Not every depressed person becomes suicidal, though. An important thing is to understand depression is a medical illness and it's highly treatable. So whatever else you do, try to persuade the person to seek competent evaluation and treatment. Okay, we have another question. What do you think causes suicide, is the question. Well, suicide it's the most complex of all human behavior. No one thing can cause suicide. Rather, it's a multi-determined behavior that it defies any simple or single cause explanation. The underlying reasons for suicide are deep and long-standing. They typically involve low self-esteem, feelings of worthlessness, and back to depression again. I mean, untreated depression really factors in there as well. And then our final question that we have is there any type of person that commits suicide? The answer to that is no. Suicide has no boundaries. Suicide occurs in every social class, every culture, and all ages. The occurrence of warning signs in someone should never be dismissed with, a statement such as, oh, he's not that type, or oh, she's not that type, or she would never do that. She doesn't fit into that. It has no boundaries. So it's very important to watch for those warning signs. Okay, thank you all very much, and I hope you have a nice evening. If you think of questions, please feel free to email them forward to us and we'll respond. And as I stated in the beginning, I'll be more than happy to mail out materials if you'd like. Thank you and take care.